Welcome back to our very next episode of 20 Minute Clinic. I am with Paul, as ever.
Hello, on the wires doing the technical stuff, keeping him right.
Absolutely. We are really grateful to have an exceptionally experienced colleague based very much here at Carlisle Healthcare, but has kind of watched general practice progress, grow, develop over the last almost 30 years.
A little bit more.
Sharon, nice to see you. Thank you so much for your time. Thanks for coming on. Just tell us a bit about your role then, specifically in primary care. Go on.
So I started at 18 as a receptionist, and that was at Portland Square. And basically I have done virtually every job, even clean the toilets. So receptionist, then I was receptionist supervisor, then I was kind of like assistant manager at the time. We had practice manager, worked alongside them. And then I did a bit of a sidestep, and I've worked in the data team probably since 2005, I think it was. So a lot of that is dealing with the letters, basically, that the patients do. So anything generated from a visit to hospital, whether it be A&E, an admission to hospital, an outpatient, all of those all come through my team. So I'm now team lead and manage that team, who called the scanning team leader, but they do a lot more than just scan a letter. A lot of coding off that, which is taking important information which feeds into the other teams in the building. I'm also looking after summarising and registration and pathology, so all the results and things that patients go for, blood tests, x-rays, that kind of thing, and managing tasks that then come from there. So yeah, there's a team of about 10 of us.
When colleagues have mentioned about you coming aboard, I was really intrigued actually, because I think for somebody still probably early on in my journey in general practice, I like to think myself
These mere youths over here, you know?
I absolutely. Well, yeah, I'll hold on to that. But the journey you've been through and the history of this place, of primary care across the region, I'm really, really keen to hear some of that.
Well, it was quite funny the other day, actually, because the medical students, as you know, they've been in the press lately, because there's a whole load of new guys coming about. They came into our admin office just the other day, and I actually looked at them and I thought, geez, you know, not so long ago, I was old enough to be the medical students or the registrar's mum. Now I'm nearly old enough to be their grandparent. So that was kind of like kind of like a kind of, oh, wow. So yeah, I started back when I was 18 in 1988. So that was Dr Kirsten Partners, who were based in Portland Square. So very old-fashioned Victorian building, back in the day when everybody was pen and paper, no digitisation at all.
Just that world in itself, probably a different world altogether.
Absolutely. Big appointment book that was all written in. You had to Tipex. Can you remember those Tipex from back in the day? When patients cancelled, you know, us very much calling the patient, sending them through to the GPs, all paper records. So everything was in the paper record, everything was handwritten. Every prescription was handwritten. The age sex record, which was a little tiny drawer full of little cards for individual patients. So if you could put that in perspective now, when we're in a practice of what we got now, about 40,000 patients here.
About that, yeah.
So back then, there was thousands of these cards, but obviously the practice was a lot smaller then. And then jump that forward to now, and it's just an absolute massive change in between. Yeah. There for the digitisation back in 95. I did have a break in time. In 95, I went off travelling in 1995 and then came back. And as I came back was actually just as they were introducing the first computers at St Paul's, as it was then. I think it was 1994, perhaps, we moved over to St Paul's, and that seemed a big, massive move from this huge building. One of the biggest things was we all got fat because we all sat down, because we'd been so used to running up and down stairs and standing all the time, and we went to being sat behind a desk. But I do remember the advent of the digitisation when that first came in with the first computers, and everybody being terrified that the appointment book was going to get taken away. Wow, and it was, that was a really sort of scary point. And there literally was, I think, 2 computers on the front desk and one that was like a sort of database almost when it was first used, because everything had to be transferred over to what was back in those days could have been the Family Health Services or the Family Practitioner Committee, which used to be in Brunswick House on the corner of Brunswick Street. Wow. So, yeah, and then eventually the doctors all started getting a computer, but initially everything was still with a dual system. Okay. So you would still have paper records as well. And then gradually over time that grew and grew and grew to where we've got now. I mean, the NHS IT programme, which ran and has been running for many years, was aiming to go paperless. Fortunately, that hasn't happened. We still do have quite a lot of paperwork, but we do have a large majority that is digital now. So I think people might see the past as a simpler world. I mean, I do remember a story once of the patients have this, like the family doctor kind of thing. And I think it quite often wasn't it? They grew up with that doctor. They knew their whole family. They didn't have to explain everything because that doctor knew everything about them. And, you did as a staff member as well. You knew, that's such and such's mum, and that's, you knew everybody. But it didn't always have its plus points, for the traceability of things now and the audit trails and that kind of thing. I mean, like a little story of this patient once came in and just dumped a bottle on the desk and turned around to walk out, and Dr. Kersel, do that for me. And I was like, whoa, hang on a minute. And he came back, and eventually when I got to it, it was a bottle that had the tablets on it. It didn't even have a name or anything of what it was.
Wow, okay.
So, but then I suppose the doctors maybe knew them, and I also remember the paper records and how over time that had to evolve with the digitising, because the doctors would know somebody so well that, they'd put ISQ in status quo, which meant nothing had changed. Well, that wasn't a lot of help if somebody else came and saw that patient afterwards, but it was of that generation where they just saw the same person all the time.
It's fascinating, isn't it? I mean, I sit here and I love the history of where the NHS has gone through, but I think where we were and the way we practiced primary care and general practice just feels a different planet to where we are at the moment.
Completely, yeah.
I've seen some stuff, even when you get the classical thing about, I don't know, insurance medical come through, and as a GP you end up with the EMIS records, but then you also have to just delve into the paper records, which just feels like you're just in a time machine.
Yes.
Going back in time, and you just see kind of GPs before us with the handwriting and exactly what you say, just one line of chest infection plan antibiotics.
Yeah, and a lot of it was abbreviated.
Yeah, absolutely. And I think now, I mean, goodness me, my consultation downstairs, for example, I probably put 5 or 6 lines. Yeah. And then a section on examination, and then a plan, and get it all boxed off. And I just think, how have we got from literally a one-liner through to War and Peace almost?
And I suppose that's something the patients don't see, this extra work that the doctors are putting in terms of detail to fill out things as well.
That's always been a misconception. I know when we used to interview for receptionists, it was always a nice little job at the doctors. But people don't realise what goes on behind the scenes as to how much work that is actually involved. And I think as well, a misconception years ago, a lot of the patients always thought the doctors did everything, which to some extent, sometimes they did, but that has changed dramatically. Yeah. I mean, us for a practice, we devolved and had little teams that would take on the responsibility, because the GPs just couldn't do it. As you well know, the demand from telephone calls, from home visits, from referrals, from all of the normal prescriptions is a massive thing. So a lot of the work, like the secretarial team do a huge amount of work. We have a recalls team that do a huge amount of work behind the scenes. My team that I manage look after all the letters, all the pathology results, everything that goes on and goes into the patient record. It's actually a quite a mammoth task, really.
And again, massively different to what it was back in the day.
Oh, huge.
Because you're right, the volume of stuff coming through was very different.
Yes.
And again, that continuity helped with being able to see, I don't know, Joe Blogs, have that review of them and be able to go, I'll see you next time and we'll follow this up.
Yeah.
Whereas now there is, I mean, I'll be honest with you, feels like sometimes like a bit of a battle in the wider system to try and follow up an individual patient, see them through, or chase a letter or whatnot. So it's definitely changed. Change can sometimes be really beneficial, sometimes really important.
Yeah.
What do you think has probably been the best thing that you've seen improve or change in those sort of days?
I think the massive thing for us was just before COVID, and we were really lucky that we got on that bandwagon, was the online consultations. Okay. And I know that's a bit of a Marmite thing.
Yeah, go on.
I think it is a bit, and I get it from both sides, but I think for a lot of people in the way that world that we live in, I think it does help for they're sort of making sure that patient gets into the right pathway, so that, they don't just end up clogging the system, so that people who genuinely need to see the GP, those ones that may well have been hiding that lump they've had for ages and they really should go and see about, and they haven't come in, and not being clogged up by those people who can just be directed to the pharmacy or given a prescription, or, saying, well, actually, the musculoskeletal person might be the best person for you to see. And I think that's the bit that people miss. They don't get that bit, that why they've tried to put that in place. And if we hadn't have had that before COVID, I think we would have really struggled when the pandemic hit, because, we were just lucky that we'd all learned about that, we'd all got taught about it and got the knowledge out there.
It's true. The online consultations definitely has pushed us in primary care forward, but also almost challenged patients as well in this to really adapt to it all. And I think there was a real steep learning curve before COVID and even during COVID when that kind of changed. But I think you're right on overall. I think my own reflection is that we've had a definite chunk of unmet health need.
Oh, yeah.
That now access to primary care isn't an 8 a.m. battle over the phones.
Yeah.
It can be an online form to fill out. And my only angst I still have, and I still wrestle with this, is those individuals who aren't keen on IT.
Yeah, I know.
Those are the battles. But I suppose the phone line is always there.
Yeah, I think it's difficult as well that the NHS and general practice has got a really bad name over the last few years, hasn't it? Because of that 8 a.m. battle. And the amount of times I see it in the press that, the doctors want to get to work and see people. And you are seeing people. And it's really hard to think, you don't realise what goes on behind the scenes. And, people do really try hard, and that you're not in this profession not to see people and not to care about them. That's what we're here for. That's what we're trying our best to do. I do understand where people are coming from and the frustrations, and I know NHS waiting lists are horrendous, and that's something that's out with our control in general practice. But it's not an easy field to work in. It never has been, but I think it's particularly difficult at the moment as well.
We've talked about some of the benefits, some of the evolutions as such. What do you feel as though, let's just be open and honest with each other. I think Paul knows that we're fairly honest, aren't we, on the podcast?
Yeah, we try to be open and say how it's actually going.
I can say and wave the flag for primary care and we're phenomenal. I think sometimes we could do better at times. What's your own reflection about where we think we've lost our way? Or
I think in the NHS and general practice, a lot of it, the issues is the IT systems talking to each other. I know just from past history over the years, sometimes there's that frustration and the communication between primary care and secondary care. So that's like general practice, so doctors and hospitals. Sometimes that could be better. I know sometimes it gets frustrating, and I've had it as well with my team. We're all on the same team. Yeah. We're all trying to work for the best end for the patient at the end of the day. And so I think the IT system, sometimes there's that many different ones, and there's different ones throughout the country, and that can be really frustrating and sort of hold things back.
It's interesting you mentioned about the primary secondary care as well, about almost the divide. Yeah. And I think you're right about the IT systems being different. Yeah. And that almost creates a bit of a partition between the two.
Very much so.
From there on.
Because patients think that it's almost like a generic whole record, that we see what they see and they see what we see. Yeah. And I remember one day having a bit of a thing with one of the secretaries at the hospital, and I ended up saying to her, look, we're on the same team here. I'm not trying to make more work for you, and, vice versa. We just need to work to sort this problem out for this patient. We just need to work together on it. And to me, that's logic, and I don't really understand why that can't happen. I get frustrated with that. At the end of the day, we're here to sort the work out for the patient and help them for the best end, aren't we, really?
So go on then, as somebody very, very much kind of a lot of wealth of knowledge in the system, kind of sees it on a day-to-day basis. If you had a magical wand, we'll get to that at the end of it. Okay, we'll get
to this question. Yeah, it's his big end question.
What would you say actually? What was one key thing you'd say that you'd like to see happen in the NHS to allow patient care to be as best as possible?
Well, I just think the chains of communication between secondary care and primary care should be better. It was only recently, last year, Robert Westgate asked me to be part of a board to speak about the letters that come back, sort of just to say, like, right, from your perspective, you're dealing with it, what can we do better, where have we gone wrong? And there was this big board of people, and I was the only person from general practice in my kind of level. And it's ridiculous that I've done this job for nearly, more than 30 years, that's the first time that anybody's thought to ask. And it's like, people are scared to speak to a consultant. You know, it's just the same as me and you. We just took a different journey in life, that's all. You know, and there was a consultant there, and we had a really good chat and a really good banter. And it's like people are afraid to question why something's always happened and can't be changed. Okay. You know, and it's like, well, if you can just make some slight tweaks, like one big thing that Robert pioneered was getting an email contact on the hospital letters. And that has made a massive difference. You know, trying to phone the hospital, you'll know yourself, trying to speak to the right person at the right time, because they're all so busy. And what you need to speak about isn't necessarily urgent. But if you had that email, you just say, well, quickly, could you look at this? And when you've got a minute, could you send me back? And it's brilliant.
Yeah. So would you say there are some bridges being built?
Yes, that's what I was saying, that it's just starting to get there, that it's, like you say, there has been that them and us.
I would share with you as well that there is that recent shift in culture, I think, because there's a realisation, post-COVID, if I can say that, that the only way we could work together is... The bottom line is we have to work together.
Yeah, absolutely.
So I think there's a realisation that collaboration is going to be part of this. And I think some feedback we've had from the podcast and discussions with others, that there are secondary care colleagues going, actually, you know what, things are beginning to turn. And we absolutely applaud that. And definitely, I mean, if suddenly secondary care, primary care went off in different directions, we'd both crumble. Yeah. Let's just be honest with each other.
So, absolutely.
So I think it's so nice to see that we are kind of that realisation of things turning and improving. I take your point, though, it's still challenging, though. Yeah,
I mean, I do understand it for the pressures and how busy they are and everything. We all get that. We understand that.
It's a very big ship to turn, isn't it?
Huge.
So
huge.
Any sort of step forward, I suppose, is good and positive.
But it's funny how you could speak to one trust and speak to another and they'd be completely different. That's, you know...
It's that fragmentation, that difference, isn't it?
Yeah.
What, just in the final few minutes, what next?
Well, AI's the big thing, isn't it, on everybody's...
Polls is...
I'm, sci-fi fan here. I'm worried about the Terminator and various
Well, exactly,
things.
Me too. Skynet's going to be there, isn't it?
Exactly.
Can you imagine Terminator as a receptionist?
Maybe not in our lifetime, but who knows?
Let's not scare the listeners too much.
Yeah, exactly. Yeah.
Go on. What are your thoughts?
Well, there are some practices who have been implementing it, and obviously like online consultations kind of like the first step along that route. And we in my team have been looking at a programme to help us with the documents, dealing with the documents, because we pull a lot of information from those documents and put them into patient records. So I've got an open mind, I think. I wouldn't say that I was positive or negative. I think it has its pluses and its minuses, and you have to give it time and you have to have a good look at it and good think about it. And I think for some of the aspects in primary care, it's still in the early stages, isn't it? Still quite small, really, in comparison to some other AI programmes.
How's that? How will that impact on patients, you think? Good thing or bad thing?
I'm not too sure. From some of the background things, they wouldn't even know that it was going on.
Okay.
You know, if things became too automated, my worry would be that things weren't pulled off that should be. But I don't really know enough about it as yet. We haven't had a look at it that much, but I do think it's kind of the future. It's the way that everything's going, isn't it?
Wow.
And it's still developing, isn't it?
It is, very much in development stage.
Steps.
Yeah, well, a programme we looked at was only in about 10% of practices, which isn't a huge amount of practices when you think how many there are within the country. So, you know.
Something like that. But, I mean, again, just when you look at the whole spectrum of writing in note. Right? Pen and paper, all the way through to using AI and computers and modelling, those sort of things. I mean, that's just polar opposites and planets away from each other, aren't they? So, you know what? Really interesting, really fascinating. I think I've learned a bit as well about the direction, actually. And again, a bit of an appreciation. You actually realise how far we've come.
Yeah.
And I think,
you do.
Again, I think this is probably kind of on the cusp of something really interesting on the back of AI, the primary, secondary care stuff. Really interesting. I think we're hearing across the region why that's becoming a bit of a point towards better collaboration and working. So that's really nice to see and hear.
Yeah, definitely.
Sharon, thank you so much for
You're welcome.
Your time. And I'd love to have you back on again at some point just to unpick what your journey's been like.
Share some more stories.
I'm a big fan of stories.
You like the story?
I've often thought about writing a book. There's that many of them that
there you go.
You know what? Secret Life of
Secret Life of a Receptionist.
You'll be on that book tour soon, right? Doing sign-ins and
Amazing.
Maybe not.
Thank you so much, Sharon.
You're welcome.